Hello, this day I think the word hi really in me. A study on the change in police after the focus event Corona-19. Doctor in the Crisis Management Corporation course at Chungbuk National University. I am geun. My research focuses on the policy change due to the current pandemic COVID-19. Most countries have been under panic since COVID appeared at the start of this year. It is said that contagious diseases are more deadly than war to humanity. The first COVID-19 victim was first sighted in Wuhan, December 2019. The disease was later spread to South Korea, and the first victim was discovered in 2020, January 20. The Korean government took urgent action to prevent the spread and to discover the entry route of virus into the country. However, despite the effort, confirmed case of the virus did not drop. In January 27, the government elevated the national crisis alert level from concern to caution. Mass infection in a church in Daegu and a hospital in Cheongdo kept the number of confirmed cases high. This caused the alert level to raise again from caution to serious. Since then, the number of confirmed cases has not down for a full year. Some countries in Europe developed vaccine and are currently in the inoculation stage. As of midnight on December 15, there were 880 daily confirmed cases in South Korea, with a total of 44,364 confirmed and 600 dead so far. The number of confirmed cases worldwide is 71 million, and the number of deaths is 1.6 million. It truly is crisis to humanity. Classifying the corona outbreak as a focusing event. I have been researching on the overall process of how COVID-19 changed and shifted politics from setting political agendas to making political decisions. Utilizing and comparing the current ERPL model. Is the COVID-19 pandemic? I analyzed the process of each stage to change politics when confronting a focusing event. Contents. The order of presentation will be presented in the order of instruction, conclusion, and policy implications. As an instruction, does anyone know how the name COVID-19 came? New coronavirus infection is called novel coronavirus disease, and COVID-19 is short for coronavirus disease 2019. The CO stands for corona, VI stands for virus, and D stands for disease. The virus was first reported in 2019, hence the name COVID-19. South Korea course is Corona-19, short of coronavirus disease 19. Corona-19 domestic and foreign progress. We will take a look at the state update of corona domestically and globally. December 31, 2019, a pneumonia patient was discovered with an unknown cause. The first confirmed corona case was discovered in 2020, January 20. The national crisis alert level was set to concern. Later, the alert level was elevated to caution and then to serious. March 11, WHO announced COVID-19 outbreak of pandemic. Due to increasing corona patients, the government set and announced strict social distancing. This policy was later eased up. However, with steadily rising case reported, strict social distancing was set again. Definition of focus event. To take a look into the historical background, Falkland in 2009 defined and classified a focusing event as a suddenly happening event which analysts and political decision makers are aware of, while grabbing attention from the public. It is an event which will probably negatively affect the true future and has the potential to stimulate problem and issue later on. Type of policy variation. There are types of policy change, policy innovation, policy succession, policy maintenance, policy termination. Falkland's model of policy change in focus events. Referring to Falkland's model of policy change in focus events. When a focusing event occurs, agenda steps to grab people's interest, and collective mass mobilization is formed with various ideas, discussion on new policies, overall an environment for instrumental policy learning and social policy learning is creative. Theorem of major proposition box in Falkland's model, defining the main proposition of Falkland's model. Focusing event grab attention of the National Assembly and social media. Focusing event form collective mass mobilization. Pretty exciting politics gain attention and are revised. Post-focusing event that plus social learning should be simple and clear. However, real life situation may not always follow this model. There are acceleration factors and hindrance. Attention from media and a clear advocacy group may stimulate the acceleration. Hindrance may include unclear information. Three types of policy learning. We separated police learning into three categories: instrumental learning, social learning, social police learning, political learning. In precedent study on focus event in 2010, Lee Dong-gyu conducted an introductory study on the applicability and different type of focusing event defined by Parkland. Many researchers participated in this study. Analysis frame of police learning model. Applying Parkland's event-based police learning model, we take a look at the stage of police learning. Users bring up an issue, collective mass mobilization, idea discussion, and adopting a new policy. Investigation of research. The increasing interest in agenda item due to the occurrence of focused events is checked by TV and newspaper news article. The organization of the special committee and the mobilization of experts shall be verified by collective mobilization. The idea discussion materials check the minute of the National Assembly and the government press release. The adoption of new policies are confirmed by the enactment and implementation of law. The agenda of a focal event. Press report analysis. This is the first analysis result. The number of press reports was analyzed to confirm the agenda of the focal event. Data was collected from media releases starting from January 20th, the data of the first confirmed case to November 20th. Information collected were limited to 4 TV broadcasting program and 11 newspaper companies. The number of press reported is 10,599 per TV and newspaper, and 1,602 for government report. Suggestions for disease prevention measures were brought in the National Assembly 434 times. Therefore, COVID-19 as a focusing event affected media agenda. Collective mobilization, National Assembly. Evidence of collective mass mobilization could be viewed from the National Assembly. National Assembly Corona-19 Special Committee on Countermeasures was opened 3 times. Subcommittee on the Health and Welfare Committee of the National Assembly and National Assembly Health and Welfare Committee were active as well. With the government collective mobilization of experts, he held a meeting with the various organizations, including the Korea Hospital Association and the Small and Medium-Sized Hospital Association, and also operated pan-government support group and working group. 2, idea discussion. The National Assembly opened the National Assembly Corona-19 Special Committee 3 times. The main topic of the conversation was coming up with a solution to reduce economical damage. The National Assembly has an welfare committee and subcommittee proposed 234 amendments to act on the prevention of infectious disease. The adoption of a policy. The National Assembly Corona-19 Special Committee approved a resolution to prevent future spread and to conquer the virus outbreak. During the 20th National Assembly, some body revisions to the Act on the Prevention of Infectious Disease were passed. It was declared on March 4 and enforced on September 5, 2020. During the 21st National Assembly, some amendments to prevention measures were approved. One was carried out in August 12th, and the other on September 29th. Finally, the conclusion and policy implications are: from the outbreak of COVID-19, the occurrence of confirmed cases and the rising of infectious disease crisis alert level up have affected the setting of agenda. The collective mass mobilization approved the resolution and 234 prevention measures. Through discussing ideas, the National Assembly approved, promulgated, and implemented one resolution and some revisions to the 3 infectious disease prevention law. Therefore, from the first case to November 20th, the focusing case followed a type 5 from the Falkland police learning type. As a proposal, there should be following researches for focusing cases that were early resolved and did not give major impacts on police. A study comparing relative major and minor focusing cases should be conducted. Day by day, the amount of confirmed cases is increasing, so let's all wear masks and keep a safe distance away from crowded areas. Prevention is the best vaccine. Stay safe. Thank you.